All right, let's talk about Streptococcus and the diseases caused by streptococcal species. My picture over here got stretched out kind of funny, but you guys know what a streptococcus looks like. They are gram-positive, they are little cocci, and they are often found in chains like this, although when lots of those chains are together, they can bunch up and look more like staphylococci. We can differentiate them from the staphylococci because they are catalase negative. They do, however, have peroxidase, which allows them to grow in the presence of oxygen, and they are facultative anaerobes. Most of the time, they actually carry out fermentation. We categorize Streptococcus into groups A through H based on some antigens that they present. These antigens were originally identified by a woman named Rebecca Lansfield, so they are called Lansfield designations. Most of the disease is caused by group A and group B strep, and we'll talk about both of those along with Streptococcus pneumoniae. And as you all know from lab, we also talk about hemolysis types when we talk about strep, so alpha, beta, and gamma hemolysis. First up, let's talk about group A strep. Now, it's called group A, but it's really just one species, Streptococcus pyogenes. We've used it in the lab before. They grow as white colonies on agar, and when we grow them on blood agar, they are beta hemolytic. So again, that means this nice, big, clear area where all the red blood cells have been destroyed, and we have our tiny little colony right in the middle. The pathogenic strains of S. pyogenes often have a capsule. So that, again, that helps prevent phagocytosis and lets them evade the immune response. Other virulence factors include some things we've talked about before, some streptokinases that break down blood clots. They actually have two of these. A C5a peptidase that helps evade immune responses. Pyrogenic exotoxins. So pyrogenic means fever-causing. And superantigens. And again, superantigens overstimulate the immune response. So these types of exotoxins and superantigens, they stimulate macrophages and T cells of our immune system to release cytokines, which are inflammatory modulators, immune modulators. The result of cytokine production are symptoms that we're familiar with: fever, rash, and they can also cause systemic shock and lead to death if not treated. Strep species can also produce a number of streptolysins. These are pore-forming toxins, right? Lysins are going to lyse cells by punching holes in the plasma membrane. And streptolysin O can lyse white blood cells, like our immune cells, platelets, various tissue cells within our body, and there's also streptolysin S, which can lyse a number of cells as well. So a variety of virulence factors produced by group A strep that contribute to the state of disease. Group A strep can cause many diseases. The one that you will be most familiar with, however, is pharyngitis or strep throat. We've all had strep throat at some point in our life. Its hallmark is a really, really red throat with some of these pussy deposits on the tonsils and the back of the throat. And these are caused by the effects of streptolysins killing the cells of the throat along with white blood cells that are there to try and clear up the infection, and those pyrogenic exotoxins. So the red, the fever, the heat on the back of your throat is caused by those pyrogenic exotoxins, and the pus, which is actually just dead cells, is caused by those streptolysins killing cells at the side of the throat. Now, in this day and age, because we have antibiotics that we can use to treat strep infections, we don't generally see complications from strep throat. But there are some things that can happen that used to happen more historically and still do happen today. And one of those complications is scarlet fever, which you have probably heard of at some point and maybe didn't really know what it was. Scarlet fever occurs when those pyrogenic exotoxins make their way into the bloodstream. So when they leave the throat and they make their way into the bloodstream. And it's characterized by this really bright red rash on the trunk of the body. So that's why it's called scarlet fever, because of this color that it can produce. Another complication is the development of rheumatic fever. And this occurs when antibodies that would normally attack Streptococcus wind up attacking structures on the heart instead. So it can cause inflammation of the heart And the damage caused by this is lifelong. It doesn't go away once the infection is cleared. Group A strep can also cause a toxic shock syndrome. Here we call it streptococcal toxic shock syndrome. Like with scarlet fever, it's produced by those pyrogenic exotoxins in the bloodstream. And here, the bacteria are spreading from the initial site of infection, so a cut, a scrape, a strep throat, and they're getting into the blood in an uncontrolled fashion. So it's different than scarlet fever. It causes severe pain of our person, fever, vomiting, and multiple organ failure due to infection and due to the immune response and inflammation of the organs. This is fatal in about 40% of cases if it's left untreated. The final group A strep disease, and the grossest, is called necrotizing fasciitis. That's what we're seeing in our picture over here. In this case, Streptococcus group A strep gets into the body by usually a very small cut, and the bacteria spreads along the fascia. So it spreads through our person's tissues right along the fascia. As it reproduces and spreads, it's producing streptolysins, which kill off the cells and destroy the tissue. This is also called flesh-eating disease because the tissue will eventually die and you'll wind up with huge parts of the muscle and skin that are gone due to cell death. This is 50% fatal, even with treatment. And often what happens is that the bacteria has spread so far up that you need to amputate a limb. And even amputation may not be enough to save your patient if the bacteria has gotten into the bloodstream. So it's a very dangerous disease. We need to catch it early and treat it early in order to save our patient. Fortunately, strep infections are pretty easy to test for and diagnose. Again, we can use skin lesions, so we can take scrapings from the skin, we can take blood, pus, or any other body fluids, and do a gram stain to look for gram-positive cocci in either short chains or pairs. From the pharynx, from the throat, you know that there's a rapid strep test. You've probably had it done before. That will tell you whether or not you have strep throat in a very quick amount of time. Those can show up as false negatives, however, so in addition to that rapid strep test, your doctor will probably also order culture on blood agar to look for beta hemolysis for group A strep. Now we can treat these pretty easily with penicillin. Penicillin and its derivatives are very, very effective if the strep species happens to be beta-lactam resistant. Something like erythromycin will work, or cephalosporins, although cephalosporins are also beta-lactams, so they may be ineffective if our bacteria have a beta-lactamase. Now we can prevent strep infections, again, by practicing good hygiene, but one of the interesting issues with it is that we don't really produce a good immune response. Our body will make antibodies against really one particular protein that the bacteria produces called M protein, but that M protein can vary from strain to strain. So within our group A strep, we can have multiple strains, and our immune system will not recognize a second strain after infection with the first. And this is why a person can have strep throat more than once. Say you get infected with strain 1 the first time, and the next time you get infected, it's with strain 2. And your immune response does not recognize strain 2 because the M protein is slightly different. And that really stinks because strep throat is terrible and no one should have to have it more than once in their life. Next up is group B strep, or GBS. And again, this is just one species. It's Streptococcus agalactiae. This one is, again, short chains of gram-positive cocci. They have a slightly more yellow color, so they're described as buttery colonies, and they produce a very small zone of beta hemolysis on blood agar plates. So Streptococcus pyogenes causes a huge zone of hemolysis. These make a small zone of hemolysis, and we looked at that in lab. So here's our group B strep over here, and their zone of hemolysis is so small you can't even really see it in this picture compared to group A strep. Group B strep is part of the normal microbiota for many, many adults, not all, but for many. and it can be found in the lower gastrointestinal tract, the genital, and the urinary tracts. And in adults, it doesn't really cause any sort of disease. Where it does cause disease is in newborns. When a newborn is infected, they acquire the infection through the birth canal of a group B strep positive mother, and it can cause bacteremia, which means bacteria in the bloodstream of our newborns. Because they're little babies, their immune system is not fully developed and it's unable to fight off this pathogen. So the strep can grow very, very quickly in their bloodstream. And the result is that that bacteria can cause meningitis, which is an inflammation of the meninges in the brain, and pneumonia, infection in the lungs. And this loss of oxygen and this brain inflammation can lead to seizures. And we're talking about seizures within the first few hours to days of life. These seizures, of course, can cause their own brain damage, and an infection is 5 to 10% fatal even with treatment. Of the 95 to 90% of children who do survive, 25% of those infants are going to have some sort of neurological damage. Often this shows up as lack of motor control, but there can be other issues as well. Many enzymes have been identified that are produced by group B strep, and we kind of know that they have a role in causing disease, but we don't really understand what they do. Again, because it's hard to run those sorts of tests on infants and figure out exactly what these enzymes are doing. In order to prevent or treat group B strep disease, pregnant women get tested twice during their pregnancy for group B strep. They get tested somewhere around the middle of their pregnancy and again a few weeks or days before their due date. If they are group B positive, they're going to be given an IV of antibiotics during birth. That way it will kill off any of those group B strep in the genital tract and prevent it from being passed on to the newborn. And for those newborns whose mothers were positive for group B strep, they're going to be treated with antibiotics immediately after birth in order to prevent colonization of the newborn and to prevent the meningitis, the pneumonia, and the seizures from occurring. And this is really effective. If you know that the mother is positive and you treat for group B strep and get rid of it, everything will be fine. And if you treat the newborn immediately after birth, everything will be fine. It's those instances where it isn't caught that we see issues. And our last Streptococcus species, Streptococcus pneumoniae. This one doesn't get a letter. It is kind of its own thing. It doesn't really have a Lancefield designation. Still gram-positive cocci. These are usually found in pairs, although they can be found in short chains, but not the long chains like we see with strep pyogenes. On blood agar, these don't really have a pigment, so they kind of look red like the agar looks, and they are alpha hemolytic. Remember, that means they cause a kind of gray or green color to occur on the blood agar. We looked at that in the lab. There are 92 different strains of Streptococcus pneumoniae that are known to infect humans. Because there's so many strains, it's hard to make a good vaccine that will cover all Streptococcus pneumoniae. They do have a polysaccharide capsule, and remember, this is absolutely required for virulence. Those that don't have a capsule don't cause disease. Only the ones with capsule do. Now, lots of different things can cause pneumonia. We're even seeing pneumonia in COVID-19 cases, but 85% of all pneumonia cases are caused by Streptococcus pneumoniae. Often, people who develop pneumonia have some sort of previous or underlying health conditions, like diabetes, a previous bout of influenza, or congestive heart failure. So things that have already weakened the body and make it harder to fight off Streptococcus pneumoniae. And the hallmark of any sort of pneumonia is that your patient's going to be coughing up sputum. They're going to be coughing up mucus from the lung. Anytime we have that wet cough where stuff is coming up, it's called a productive cough. And this is a diagnostic feature for pneumonia. If we look just really quickly at what pneumonia actually is in the lung, it's more of a descriptive diagnostic. In part B here, we have our normal alveoli of our lungs, the air sacs that fill up, have those very, very thin membranes that allow oxygen to move from the air into the bloodstream. In pneumonia, these air sacs get filled up with fluid. This fluid is pus, it is mucus, and because it's so full, it does not allow air to get down into these spaces and makes our patient gasp for breath and have very labored breathing, like we see in most types of respiratory infections, but it's even more severe when our patient has pneumonia. And while most cases of Streptococcus pneumoniae do just cause pneumonia, it can also cause meningitis. We call this pneumococcal meningitis to separate it from other types of meningitis. What happens here is that the bacteria tricks cells to engulf it. Remember, it has a capsule, so it will undergo incomplete phagocytosis. It will get phagocytized but be able to escape. While it is in those phagocytic cells, it kind of hides out and moves through the bloodstream, passing into the brain. Once in the brain, it sets up an infection and causes inflammation of the meninges. And the meninges are these three layers within the brain: the dura mater, the arachnoid, and the pia mater. And these are responsible for providing cushion so that when you move your head, your brain isn't smashing up against your skull, right? But when these become infected and inflamed down here, they're thicker and they cause a lot of pressure. So a hallmark of meningitis is intense headaches because of this swelling. And here's the brain down here marked in red to show that it's painful and hurts. Many different things can cause meningitis. It can be fatal no matter what type of meningitis you have, but the fatality rate due to Streptococcus pneumoniae or pneumococcal meningitis is 20 times higher than for other types of meningitis. So it's a very, very serious infection in the brain. We would diagnose a patient who had pneumonia by taking a sputum sample, so it's some of that stuff they're coughing up, and we would run a gram stain and a few other diagnostic tests. In the case of meningitis, the best way to diagnose is by doing a spinal tap and looking for the presence of bacteria in cerebrospinal fluid. Again, for both of these, a sputum sample or a spinal tap, we can do a gram stain, and we can use known antibodies, so antibodies that we've gotten from some other source, to identify the individual strain, which may be helpful in treatment. We can still use penicillin to treat Streptococcus pneumoniae. However, about 30% of strains are now resistant to penicillin, so it may not be that effective. Cephalosporins will also work, and erythromycin, same as for group A strep and group B strep. Now, there are some vaccines against pneumococcus, as it's called, against Streptococcus pneumoniae. There are two different vaccines. One is what we call 23 valent. Valent means how many strains does it protect against. So one vaccine protects against 23. This is recommended as a single dose for people over 65 years old because our elderly population is much more susceptible to disease and are going to have much worse cases of pneumonia than the under 65 population. And the other vaccine is 13 valent. So it protects against 13 different strains. And this one is actually used in children. Both of these vaccines are made up of the capsular polysaccharide. So they have those polysaccharides and polypeptides that make up the capsule of the bacteria. And that's what your immune system is going to react to when you get one of these vaccines. So that's it. Those are our streptococcal species, the diseases they cause, how to diagnose them, and how to treat them.